Hello, everyone. Welcome to the Nurses Heartbeat, where every heartbeat tells a story of care, compassion, and community. My name is Philip. So, in this episode, we are going to look at NCLEX exams, everything about NCLEX. This is going to help colleague nurses and midwives that want to do the NCLEX examination. So, the NCLEX examination is good for people that want to register as a nurse in America, in Canada, and in Australia as well. We know there has been introduction of the new registration pathway for nurses in 6 countries that wants to register in Australia. But the other nurses and the midwives that do not qualify for that new registration standard, you are still expected to go through the old format of registering. And in that instance, you will still need the NCLEX. So this episode and the next episodes that will come is going to talk about everything NCLEX. So stay tuned. If you are a nursing student, if you are a healthcare professional, you are looking at registrations in other countries that require NCLEX, then this is the sure place to give you all the details that you want. NCLEX is the short form for National Council Licensure Examination. So this is examination that it is set for people that have completed nursing school. So if you completed your nursing school in America, in Canada, you will still need the NCLEX exams, because that is the licensure exams that will give you your PIN, your qualification to practice as a nurse, even if you have completed nursing school. And then in the same way, if you are internationally educated nurse or midwife and you want to register in these countries, you will still need the NCLEX examination to get registered there. So let's look at the types of the NCLEX that we have. We have the NCLEX RN, that is for registered nurses, and we have the NCLEX PN for practical or vocational nurses. Because I am a nurse, I am going to dive deeper into the NCLEX RN, because that is for the nurses. Anybody that wants to register for the nurse, then NCLEX RN is for you. And those that want to be vocational nurses, practical nurses, then your pathway is the NCLEX PN. So let's look at the format of the exams. So the NCLEX exams uses the computer adaptive system called the CAT. So this is a system that assesses the performance of the individual. So when you are doing the exams, the system is going to assess you. So there is no percentage marks that will be given to you, but when you are answering the question, so let's say it starts with an easy question, and when you pass or you answer correctly, it takes you to a bit harder question. Even though the beginning of the questions are quite easy, if you don't get the answer correctly, the system will give you a similar question that is also quite easy. All right, so if you get that, fine, then it moves to the bit harder one. So as I indicated, for the format of the exams, there is no percentage. The system will give you a series of questions to determine whether you are passing or you are failing based on the scores that you are getting. That is basically how it works. So how many questions are there? The NCLEX exams is 150 questions, and you can be given anything between 85 to 150. And then within that period, it's either you are going to pass or you are going to fail, depending on what you are doing. So the time is 5 hours. You have up to 5 hours to complete. So let's say you are getting the answers correctly, consistently, then the computer might shut off from any questions from number 85. The computer might go off. So it goes off. There are two things: whether you are consistently getting the answers correct, means you are passing, or you are consistently getting the answers wrong, it means you are failing. So from number 85, the computer can shut off, and then that will determine the score that you get. In certain cases, you may also have to do all the 150 questions, especially when your scores are like a zigzagging format. So it means that you get the answers correct, you get some wrong, so you are like an average there. The system is not trying to, it's trying to assess whether you are really passing or you're failing. So it gives you the space to do all of the 150 questions as well. So that is also possible. So personally, I have taken the NCLEX exams before, and that is why I want to bring everything about it to you. And then for people that will want to explore and write the NCLEX, you also know what to do. So I wrote 2 NCLEX tests. So the first one, I did all the 150 questions because I believe my responses were like I was in the midline, so it was zigzagging kind of. So I had to do all the 151 questions. And then the second exams that I took, I answered 85 questions, and the machine stopped, and I passed that one. Yeah. So that is what normally happens. So you have up to 5 hours. So, but you don't necessarily have to sit before the computer in 5 hours. If, let's say, for instance, you have spent 1.5 hours, 2 hours, and then you are at number 85, and the system has seen your strength, then the machine can go off, and then that will be the end for you. So even though you have up to 5 hours, you don't necessarily have to sit and write for the full 5 hours. So as I said, NCLEX is just a pass or fail test, depending on how well or how bad you are answering the questions that you will be given. Why it matters? So it doesn't matter the GPA that you had from the nursing school. You may have 4.0 from the nursing school. You may have 2.0. It doesn't matter the GPA. You need to pass NCLEX before you can be registered as a nurse or a midwife in the countries that use the NCLEX. So like US, in Canada, and in Australia. If you complete nursing school, you are still not given the license to practice unless you finish, and it doesn't depend on the score of the GPA that you had. So it is important for every practicing nurse to undergo this process to get registered. And if you are overseas nurse, you want to work in some of these countries, then you have to also require to fulfill these test exams. So that is basically an overview of the NCLEX. I am going to dive deeper in the next episodes, and will let you know everything that you need to know. I see that many organizations are saying that they will help you to write the NCLEX and they will pay and everything. Can you do it yourself? In my next episodes, I will bring you everything about it, whether you need to join agencies to go through this process or you can do it yourself, how to do the registration and everything I am going to give to you. So that is it. See you in the next episode. Thank you for watching. This is the Nurse's Heartbeat, where every